Erythema ab igna, or EAI, is a skin condition that causes a distinct discoloration of the skin. It's often called toasted skin syndrome because the affected area resembles the mottled appearance of toasted bread. This resemblance is not just superficial, it points to the root cause of the condition: prolonged exposure to heat. While historically associated with open fires and occupations like bakers, today's culprits are more likely to be found in our homes and offices. Heating pads, often used to soothe aching muscles, can be a surprising source of EAI. When applied directly to the skin for extended periods, these comforting devices can lead to unintended consequences. Similarly, space heaters, particularly when used in close proximity, can also trigger this condition. Even laptops, with their seemingly innocuous warmth, have been implicated in cases of EAI, particularly when used directly on the lap for prolonged periods. The development of EAI is a gradual process, often going unnoticed until the discoloration becomes pronounced. This is why it's crucial to be aware of the potential risks associated with prolonged heat exposure from common household and personal devices. The most telling symptom of EAI is a change in skin color, typically appearing as a net-like or mottled pattern of redness. This discoloration can range from a faint pink to a deep red or even brown. In some cases, the affected skin may also feel slightly itchy or burning. The severity of EAI depends on the duration and intensity of heat exposure. While initial changes may be subtle, prolonged exposure can lead to more pronounced and potentially permanent discoloration. In extreme cases, the skin may even develop a leathery texture. It's important to note that EAI is a painless condition in its early stages. The absence of pain can be misleading, as it might delay the recognition of the problem. This is why being vigilant about any unusual changes in skin color, particularly in areas frequently exposed to heat, is crucial. Early detection is key to managing EAI. The moment any unusual discoloration or changes in skin texture are observed, especially in areas frequently exposed to heat, it's crucial to discontinue the use of the heat source. This simple action can prevent further damage and allow the skin to begin the healing process. While the initial stages of EAI are often reversible with the removal of the heat source, prolonged exposure can lead to permanent changes in skin pigmentation. This is why timely intervention is crucial. If you suspect you might be experiencing symptoms of EAI, it's important to consult a dermatologist or healthcare professional. They can provide an accurate diagnosis and recommend the appropriate course of action. A dermatologist can diagnose EAI through a physical examination and a review of your medical history. They may ask about your use of heating devices, exposure to other heat sources, and any other relevant factors. While there's no specific treatment for EAI, the primary course of action involves removing the source of the heat. In some cases, topical creams or medications may be prescribed to manage symptoms like itching or inflammation. Preventing EAI is largely about adopting simple precautionary measures. Avoid prolonged direct contact with heating pads, laptops, and other heat sources. Use heating devices safely and responsibly, and always be mindful of any changes in your skin. Remember, early detection is key.